So welcome to this session where we are going to revise the lower limb, especially the front of the thigh and medial side of the thigh. We are going to have a fast revision of the lower limb. So lower limb also called as inferior extremity, and in medical language they call it infex. So this is one lower limb which I have drawn for you. This is the medial side, right? This is the medial side. This is the lateral side. Okay, so lateral side is the medial side. So second leg will be here, okay, with the two thumbs by the side. So we always have to draw this sign whenever you are drawing anatomy. So this is medial, this side is lateral, this side is superior, this side is inferior. So this part, normally people say my leg is paining. Actually leg is only from knee to ankle. Okay, so this knee to ankle area is called as leg, while this part is called as thigh. Entire limb is called as inferior extremity or lower limb. This is foot. So what we say my foot, and also this part is foot. So this is the thigh and this is the extensor muscles. The extensor muscles are located on the anterior surface. This is the anterior surface which you are seeing. This is the medial surface. This is the lateral surface. And then there is posterior. So posteriorly are flexors. So what happens in case of the upper limbs, if this is the upper limb, in case of upper limb, the flexors are anterior. Okay, here is elbow, here is wrist. Okay, so upper limb flexion is like this. Okay, upper limb flexion is like this. So when I am showing you my upper limb, this is the anterior or flexor compartment. So when I contract my elbow, okay, this is the flexion happening. But lower limbs in our body, these are my two lower limbs. My lower limbs are like this. Okay, their flexor surface is on the posterior aspect. Their flexor surface is on the posterior aspect. So places, if suppose these are the two knee joints. So this is flexion of the knee joint. Okay. So upper limb, the flexor surfaces are anteriorly. Lower limb flexor surfaces are posteriorly. So lower limb, when we flex the knee, our leg gets lifted up from behind. But when we flex the elbow, our hand, our upper extremity gets lifted up from anterior aspect, from ahead. Okay, not from posterior aspect. But when we flex the lower limb, we flex it the knee from the posterior aspect. So then we whenever we remove the skin of the front of the thigh, okay, this is what we see. We see a huge vein called as saphenous vein. Saphenous means easily seen. So after we remove the skin in the superficial fascia, so below the skin is superficial fascia, which is fatty, and below that is deep fascia. Okay, so below the superficial fascia is deep fascia. So skin, superficial fascia, and deep fascia. These are the three layers we come across when we are dissecting. So after we remove the skin, we see a saphenous vein. And we see three tributaries: superficial, external, pudendal. Pudendal refers to the genitals. Superficial, external, pudendal vein, superficial epigastric vein, and superficial circumflex iliac vein. Okay, so these are the three veins, and corresponding arteries, which are branches of femoral arteries, are also seen in this area. Also in the superficial fascia, we see lymph nodes, and they are arranged in T-shaped. See, this is the horizontal and this is vertical. These lymph nodes are called as superficial inguinal lymph nodes. Right now I'm talking about the uppermost part of the anterior surface of the thigh, where there is an inguinal ligament which runs from the hip bone, anterior, superior, iliac spine. Now this may appear like a bombardment of terms for those who are attending a lower limb lecture for the first time. So anterior superior iliac spine to pubic symphysis. So pubis, all of us know. So there is this inguinal ligament. This inguinal ligament kind of separates abdomen from lower limb. So above the inguinal ligament is abdomen, below the inguinal ligament is lower limb. Okay. And then we see this one muscle, which is kind of diagonally running in the upper part of the thigh, dividing it into upper and lower region. And then we see medial, intermediate, and lateral cutaneous nerve of thigh. There are three cutaneous nerves of thigh, which we see here. We also see ilioinguinal nerve over here, and the femoral branch of the genitofemoral nerve in this area. So basically in the superficial fascia, we see cutaneous nerve, medial cutaneous nerve of thigh, intermediate cutaneous nerve of thigh, lateral cutaneous nerve of thigh. We see superficial inguinal lymph node, which are T-shaped. Okay, there is this is medial part of the T, lateral part of the T, and vertical part of the T. The vertical part of the T will drain the lower limb. Medial part will drain the genitals, except the glans penis, also the anal canal. So see, and the lymph node draining the lowermost part of the anal canal is on the anterior side of the. So if somebody is having abscess in the anal canal area, he may come to you with a swelling in the front of thigh. Okay, currently what we are discussing is front of thigh, this area, front of the thigh. So here will be the superficial inguinal lymph node. So that is why we should be knowing which lymph nodes are draining which area. Okay, so the medial group of superficial inguinal lymph nodes, they drain the genitals and they drain the anal canal. And the lateral group will drain the the buttock area, the gluteal area. So this is about the superficial structures, and this is the saphenous vein. This is longest, cutaneous vein and very easily accessible saphenous vein. Then there is small saphenous vein. All these veins are used for bypass because I have to just open the skin, and in the superficial fascia I find these veins. So for cardiac bypass and all, these veins are used. Now what happens? Now in the below the superficial fascia is deep fascia, which is also called as fascia lata. The deep fascia of the lower limb is called as fascia lata, and below that are our muscles. Below that are the muscles. So this muscle, which is running from the anterior superior iliac spine, which we easily feel in our body. If you go on the lateral side of your abdomen, you feel the iliac, the hip bone, anterior most point of which is the anterior superior iliac spine. On the iliac crest, we wear our pants. Thanks to the iliac crest, they are like our natural belts, because of which the pants don't come down even if there is no belt. Okay. So that those are the iliac crest on which we keep our hand and stand. Sometimes the heroes in Bollywood, they stand putting their hands on the iliac crest. Okay, both hands we see people are standing. That's so from there going like this is this muscle called as sartorius. Sartorius. Okay, sartor means a tailor. So this muscle helps the in tailoring action. Sartorius. Above the sartorius are four muscles. Their names are adductor longus. It's an adductor and it's a long muscle. Adductor longus. Pectineus. Psoas major. And iliacus. Okay. So sartorius is diagonally running muscle, and above that are four muscles: adductor longus, pectineus, psoas major, and iliacus. Below are four muscles. Below are four muscles: rectus femoris, then vastus medialis, vastus lateralis, and below the rectus femoris is vastus intermedialis. So three vasti: vastus medialis, vastus intermedialis with rectus femoris on it, and vastus lateralis. So there are four muscles. There are four muscles below the sartorius. Those are vastus medialis, vastus intermedialis, vastus lateralis, and rectus femoris. Four muscles above the sartorius: adductor longus, pectineus, iliacus, and psoas major and iliacus. Okay. So this area we see a triangle. Here we see a triangle. This triangle is called as femoral triangle. It is the boundaries of the femoral triangle are superiorly inguinal ligament, which runs from anterior superior iliac spine to pubic tubercle. Then the lateral boundary is formed by medial border of sartorius. So sartorius is forming one boundary. So this is the triangle. This triangle is called as femoral triangle. And the lateral boundary is formed by medial border of adductor longus. Adductor longus. So medial border of adductor longus, medial border of sartorius, and inguinal ligament. They together form a triangle. Very important structures are there in this triangle. So here we are seeing already the femoral vein, femoral artery. And then here is femoral nerve. So very easy to remember the contents. You have to just remember the word femoral. Femoral vein, femoral from medial to lateral side. Femoral vein, femoral artery, femoral nerve. And then there is femoral canal medially. I'll explain it to you. Okay, so we talked about the boundaries. Medially is medial border of adductor longus, laterally is medial border of sartorius, superiorly is inguinal ligament. What forms the floor of this triangle? Floor of the triangle is formed by adductor longus, pectineus, psoas major, and iliacus. Adductor longus, pectineus, psoas major, and iliacus. What forms the roof? Skin, superficial fascia. Roof is, these all structures are in the roof. These all structures are in the roof. Okay, skin, superficial fascia, superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, ilioinguinal nerve, superficial branches from the femoral artery, and great saphenous vein and its tributaries. Okay, so these are the structures in the roof. Contents of the femoral triangle: femoral artery, femoral vein, femoral canal. I'll talk about what is femoral canal. Femoral nerve, femoral artery and its branches, femoral vein and its tributaries, femoral canal, and femoral nerve. Okay. Apart from that, there is now to pectoral, pectineus, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, and deep inguinal lymph nodes. Okay. Now, what I have drawn here is a view where you are looking from the side. This is posterior, this is anterior, this is superior, this is inferior. This is iliacus muscle, and covering it is fascia iliac. This is femoral artery. Behind the femoral artery is fascia iliaca. Anterior to femoral artery is fascia transversalis. So this together they form a sheet which covers the femoral artery. Fascia iliaca behind, fascia transversalis behind, which covers the femoral artery, femoral vein also. So when I take a section and see, then I see the femoral sheet. So what I have drawn here is femoral sheet. In the femoral sheet, what I see, that there is femoral artery laterally, intermediate compartment there is femoral vein, and medial compartment there is nothing, and therefore that area is called as femoral canal. And it is through this femoral canal that the herniation takes place. Herniation takes place through the femoral canal. Okay. So when I look from the front, it looks, when I actually open up and see, this is how I see. I see a vein. Lateral to the vein, I see the artery. And medially, I don't see anything. Femoral canal through which the herniation takes place. Okay. Now I'll give you a brief idea about femoral artery. So this is the aorta, abdominal aorta, which divides into common iliac artery. These are the terminal branches of the common of the aorta, common iliac arteries. This common iliac artery is further divided into internal iliac artery and external iliac. Both the common. This is external, this is internal iliac. Internal iliac supplies the structures in the pelvis. And external iliac goes below the inguinal ligament. And as I told you earlier, beyond inguinal ligament is lower limb. So when the external iliac crosses the inguinal ligament, now it is called as femoral artery. Now it is called as femoral artery. Okay. So its relations are anteriorly skin, superficial fascia, deep fascia. Posteriorly are adductor longus, pectineus, vas major. All these muscles forming the floor of the femoral triangle. It gives 7 branches. 6 branches in the femoral triangle, 1 branch in the adductor canal. Okay. 6 branches in the femoral triangle we have already studied. Superficial external pudendal, superficial epigastric artery, superficial circumflex iliac artery. These were the same as the tributaries of the great saphenous vein. There are 3 deep branches of the femoral artery. Profunda femoris. Profunda means deep. Profunda femoris artery. Deep external pudendal. Here is superficial external pudendal. Deep external pudendal and muscular branches. And the 7th branch is given in the adductor canal, and that is called as, the name of that branch is descending genicular artery. Descending genicular artery. So femoral artery is continuation of external iliac artery, which is a branch of common iliac artery. Common iliac artery, which is a branch of aorta. Aorta gives common iliac gives external and internal iliac. External iliac continues as femoral artery. So it runs in the femoral triangle, in the femoral sheath, and it gives 7 branches. 6 branches are in the femoral triangle. Of those 6 branches, 3 are superficial, 3 are deep. 7 branches in the descending genicular artery is given in the adductor canal. This femoral artery, now this is the anterior aspect, this is posterior aspect. It gives profunda femoris artery, profunda femoris artery, which goes deep. This is the anterior, it goes posteriorly. Okay, which also gives medial circumflex femoral and lateral circumflex femoral artery. Okay, so profunda femoris is one of its major large branches. Now, what is the advantage of the femoral artery? Whenever there is bleeding at the lower limb, we press at the mid-inguinal point, compress it against the head of the femur, and stop the bleeding of the lower limb. So we know femoral artery is at the mid-inguinal point. Okay, exactly in the midpoint in the inguinal area. Okay. We can feel the pulsations, okay, of this artery. We can put a cannula for angiography. Okay, whenever the angiography is to be done, the femoral triangle is opened and femoral artery is exposed and a cannula is inserted for angiography. Through this femoral artery, we can get blood for arterial blood gas analysis. Okay, so that's the important applied anatomy or clinical anatomy of the femoral artery. Okay, we can put a cannula for coronary angiography. Then after this, we studied the femoral nerve. Now in the introduction, we said that femoral nerve is the largest branch of the lumbar plexus. Largest branch of the lumbar plexus. The root value is dorsal divisions of the anterior primary rami of L2, L3, L4. The anterior primary rami only form the plexuses. Posterior primary rami of the spinal nerve, they supply the muscles of the back. Anterior primary rami, they form plexuses. And why they form plexuses? Because now it's very difficult for L2, L3 and L4 to go separately and supply the muscles. So now there is a plexus formed. So here we see L2, L3, L4 uniting. And so one nerve contains both L2, L3, all these three, L2, L3, L4. And then they'll supply different muscles. So anterior primary rami, they form plexuses. Dorsal divisions of this anterior primary rami, they always supply extensor muscles. Front of the thigh have extensors. Front of the arm have flexors. Okay, arm. But when it comes to front of thigh, there are extensors. Okay, so this femoral nerve, which is the largest branch of the lumbar plexus, formed by the union of L2, L3, and L4. This nerve then lies in the psoas major muscle. Okay, and then it comes out lateral to the psoas. Okay, and then comes down and enters the femoral triangle. Before it enters the femoral triangle, it gives a branch to pectineus, it gives branch to iliacus, and it lies outside the femoral sheath, lateral to the femoral artery. I have drawn a separate diagram. Rather, this diagram is a better diagram. It lies in L2, L3, L4. This is lateral side, this is medial side. So it lies lateral to the psoas major. Gives before entering the lower limb, before crossing the inguinal ligament and entering the femoral triangle, it gives a branch to iliacus muscle and pectineus muscle. Okay, it lies lateral to the artery. It lies lateral to the artery. And then immediately it divides into anterior branch and posterior branch, which are separated by lateral circumflex femoral artery. Okay. Anterior branch supplies sartorius. And then remaining all branches are cutaneous, medial cutaneous nerve of thigh and intermediate cutaneous nerve. Posterior branch major is muscular. It gives all branches to the muscle. Now to rectus femoris, now to vastus medialis, now to vastus intermedialis, now to vastus lateralis. Okay, and one cutaneous branch is saphenous nerve. That means femoral nerve divides into anterior branch and posterior branch. Anterior branch is mostly cutaneous. It gives medial and intermediate cutaneous nerve of thigh, and only one muscle, sartorius, is supplied. While posterior is mainly muscular, rectus femoris, vastus medialis, vastus intermedialis, and vastus lateralis. Now to the rectus femoris also supplies hip joint. Now to vastus medialis muscle also supplies knee joint. So here we have a nerve which is supplying hip joint as well as knee joint. So if there is any pain in the hip, it may get referred to knee because it is supplied by the same. Some problem in the knee may get referred to hip also. Okay, so patient comes to you just with a pain in the knee, and there may be problem in the hip because the same nerve is supplying. Okay, then we discuss the branches of a nerve. And then we had seen that branch, like there is MACD, McDonald's, branches of the femoral nerve, branches of any nerve, we described as MACV. This is how we describe the nerve in anatomy. MACV means we describe muscular branches, articular branches. Muscular branches means the branches of any nerve which is supplying the muscle. Articular means supplying the joint. Cutaneous means supplying the skin, and vascular. Muscular, articular, cutaneous, and vascular. So what are the muscular branches of the femoral artery? Anterior branch of the femoral nerve. Anterior was supplying sartorius. Posterior was supplying vastus intermedialis, vastus medialis, vastus lateralis, and rectus femoris. Articular and now to rectus femoris was supplying hip joint. Now to vastus medialis muscle was supplying knee joint. What were its cutaneous branches? From the anterior was medial and intermediate cutaneous nerve of thigh, and from posterior was saphenous nerve. What were its vascular branches to femoral artery and its branches? So in the applied anatomy, any injury in the femoral triangle area can cause paralysis of all the muscles, and pain in the hip may get referred to knee, or pain in the knee may get referred to hip, because both are supplied by the articular branches of the femoral nerve. Now to rectus femoris supplies the hip joint. Now to vastus medialis supplies the knee joint. Okay. So that's about the front of thigh, and of course deep to the sartorius here in this area is a canal called as subsartorial canal or adductor canal. Okay, it is deep to vastus medialis muscle and anterior to adductor longus. So adductor longus going down, and there we see that femoral artery and femoral vein, which were lying in the femoral triangle, at the apex of the femoral triangle, they enter this subsartorial canal, also called as Hunter's canal, also called as adductor canal. This was discovered by John Hunter and used by him first for ligating the femoral artery, or operating upon a femoral aneurysm. Okay, so the boundaries of this adductor canal are vastus medialis, anteriorly vastus medialis, posteriorly adductor longus. Okay, medially sartorius muscle. Sartorius is coming on the medial side, and its contents are same, like the femoral triangle, femoral artery, femoral vein. There is no femoral nerve, because femoral nerve has immediately divided into anterior and posterior division of. So now it doesn't exist, but its branch like so its branch like the saphenous nerve that is here, and two divisions of obturator nerve are also here. Okay, so now I will fast revise from where we started. We started from here by defining the lower limb. We said that lower limb has thigh. This part, knee to ankle is leg, hip to knee is thigh, and below ankle is foot. This thigh has an anterior compartment where all extensor muscles are there, because the knee joint, this is extension. Okay, when we kick, that is extension. Okay, for upper limb, anterior part contracting is flexion. Okay, so then we talked about the what demarcates the lower limb from the abdomen is the inguinal ligament. So then we talked about inguinal ligament, and then we talked about how if we remove the skin of the front of the thigh, we see a sartorius muscle, and above the sartorius are 4 muscles, below the sartorius are 4 muscles. Okay, and above the sartorius are in the superficial fascia, we see saphenous nerve and its 3 tributaries. We see superficial inguinal lymph nodes, and we see the cutaneous nerves of the thigh, medial, intermediate, lateral. Then we removed the structures in the superficial fascia and the deep fascia lata, and then we saw the femoral triangle. Okay, the boundaries of which were found by sartorius, adductor longus, and inguinal ligament. And its contents were femoral vein, femoral artery, femoral nerve, and femoral canal was most medial. The floor was formed by adductor longus, pectineus, psoas major, and ilus. Below the sartorius were 4 muscles: vastus medialis, vastus intermedialis, vastus lateralis, and rectus. What were the contents of the femoral triangle? Femoral artery and its branches, femoral vein and its tributaries, femoral canal, femoral nerve, of course the inguinal lymph nodes, deep inguinal lymph nodes, nerve to pectineus. Okay. Then we studied the uh, femoral sheath, which was covering the artery, the vein, and canal. There were three compartments. Canal was medial. In the intermediate compartment, there were two septae like this in this femoral sheath. Having a artery has a separate compartment laterally, vein is intermediate, and nothing in the medial compartment where femoral herniation takes place. So artery, vein. Then we talked about femoral artery, which is a continuation of external iliac artery. External iliac artery beyond the inguinal ligament continues as femoral artery. This femoral artery lies in the femoral triangle. It gives 6 branches in the femoral triangle, 1 branch in adductor canal. It runs from femoral triangle to adductor canal. 3 branches of the 6 are superficial, 3 are deep, and the 7th branch, descending genicular, is given in the adductor canal. So here we see the deep branch, the profunda femoris. Okay. Then we studied the femoral nerve. This is a better diagram. Its root value is L2, L3, and L4 from the dorsal division of anterior primary lemma lying lateral to psoas major, entering the inguinal, going below the inguinal ligament, lateral to the artery, dividing into anterior posterior division. Anterior division was mostly cutaneous, medial and intermediate cutaneous nerve thigh, supplying only one muscle, arteries. Posterior was mostly muscular, rectus femoris, vastus medialis, intermedialis, and only one cutaneous branch, saphenous, which is the longest cutaneous nerve in the body. Now to rectus femoris also supplies hip joint. Now to vastus medialis also supplies the knee joint. Branches of the femoral nerve, any branches of any nerve, we have the formula MAC-V. Muscular branches, articular branches supplying the joint, cutaneous branches supplying the skin, vascular branches supplying the vessels. Muscular branches, anterior was supplying sartorius, posterior was supplying 4 muscles below the sartorius, vastus intermedialis, vastus medialis, vastus lateralis, and rectus femoris. Articular branches supply the joint. Now to rectus femoris supplies the hip joint, also supplies the hip joint apart from rectus femoris. Now to vastus medialis, apart from supplying vastus medialis, also supplies the knee joint. Cutaneous branches for medial cutaneous nerve thigh and intermediate cutaneous nerve thigh, saphenous nerve. Vascular branches for femoral artery and its branches. Applied anatomy, no, the pain of the hip and knee may be referred to each other. Then we studied the adductor canal, which is deep medial to the sartorius, deep to the vastus medialis, and anterior to adductor longus. So its boundaries were vastus medialis anteriorly, adductor longus posteriorly, sartorius medially. Contents were femoral artery, femoral vein, but not the femoral nerve because it has already divided, and its branch saphenous nerve and 2 divisions of obturator nerve. This is used for basically for the ligation of femoral artery aneurysm. Okay.